Hi, I'm Dr. Bob Carnes. I want to welcome you to this video, and we're going to do a patient profile today on a patient we'll call Jane. Jane was in about, she's been a patient a long time. She was in about 7 years ago and then came back again this month, January of 2020. Her chief complaints related more to musculoskeletal things, the lower back. She had lifted a table wrong, and so she hurt her back. She was having trouble between the shoulder blades, her hips, also suffering with anxiety, PTSD, acid reflux, high blood pressure, diarrhea, irritable bowel syndrome. She's on about 5 medications. And years ago, she did go gluten-free, which helped her a lot, but it really, hadn't fully resolved everything. So we started treating her for her musculoskeletal problems, and then she got better with that. And then we talked about what we could do for some of her other complaints. And so on January the 20th this year, 2020, we diagnosed her with leaky gut syndrome. That's where the gut lining deteriorates and you start absorbing toxins and bad stuff into the bloodstream. Then that triggers your immune system response, which creates inflammation. Also, she had yeast. So we put her on supplements and a good diet, a yeast-free diet that we have for Candida yeast, and it's also basically a leaky gut diet. And so she started that. Now, we found her sensitive to milk. Now, how do we do that? We're just going to do a little demo here, and we're going to have Connie come in and sit in the chair. We'll just show you that. For those of you who have never seen us do muscle testing before, this is a technique that has been invaluable in finding out what somebody is sensitive to. We have further testing that we do with an instrument called the LZR7, which uses a computer and a laser, and that's very fascinating too. But I'm just going to show you kind of our basic allergy muscle testing. So Connie, if you'll come up here and just sit right here. We have these vials of different foods that we use as our test kit. So we're going to just take milk out of there and let her hold it. And she's going to hold that in her energy field. And I'm going to muscle test. Push up. Okay, she stays very strong to that. So she's not sensitive to milk. But Jane, our patient, thank you, Connie.
You're welcome.
Our patient was sensitive to it. And when she got off of milk, it was a game changer. So she came back in to the office about a week later. Well, actually it was 9 days later. And she didn't have any more diarrhea, no reflux. Her between the shoulders area was fine. She had no pain there. And it's interesting because right between the shoulder blades, those thoracic vertebrae, T4, 5, 6, 7, those all relate to gallbladder, liver, stomach, and small intestines, those digestive organs. So when you get that in place and holding, a lot of times you get a lot of good relief from symptoms of gastrointestinal trouble. And she did too. When she got off the milk, then she started holding her alignment. So yes, misalignments can be caused from food sensitivities. A lot of people don't know that. So they just keep getting adjusted over and over again and just don't know, what's causing it. That's a huge cause. And so you always want to get to the root cause. You want to identify the root cause, remove it, and then make the lifestyle changes so that things will hold better and you'll function better and you'll feel better. You'll feel like you again. That's our goal for our patients, to help them feel like you again. So the interesting thing about Jane and this patient, and this happens to a lot of patients, is 7 years ago she was in complaining with gastrointestinal trouble, IBS, and we found that she had leaky gut syndrome, and we put her on a lot of the same protocol we did this time. So what if she had stayed the course long enough to get the results that she got this time? She could have prevented all that. And so it's very important to give your body long enough to heal. And so we really want to encourage our patients to do that. So I hope this video has been of value to you, and we will see you next time. Have a great day.